that traumatic brain injury is a major cause of death and disability in the United States and beyond. It is the leading cause of death under age 45, not just in the Western world, but now across all parts of our globe. And we know that this burden is rapidly rising in low and middle income countries as they proceed through the industrialization stages. But we also know that we are dealing with just some frank epidemics in the United States itself. Every hour in the U.S., 6 people die, 31 people are hospitalized, 194 emergency room visits occur, and 457 concussions. And we all know that this has been a signature injury of our recent overseas military conflicts, just further escalating the impact of traumatic brain injury in military and public health. This is really actually no longer a silent epidemic. It is one of the greatest and most rapidly growing military and public health problems. And the incidence of traumatic brain injury and the impact of traumatic brain injury in wounded warriors and in sport has brought TBI front and center in our national discourse. There has been an associated increase in the funding associated with research for traumatic brain injury, although we still have an unmet critical need in that regard as well. I mentioned that in low and middle income countries, the incidence of TBI is rising pretty dramatically. That incidence in the United States is also being mimicked. One of the unbelievable things, though, that's happening in the U.S. is the rapid growth of incidence of traumatic brain injury in the over age 65 population. And I think for those of us on the front lines, we live this every day, where we are facing the older generation that is not content to sit in a recliner at home, but is in fact out there being active. We also know full well in neurosurgery how many of them are on antiplatelet medications and oral anticoagulation therapy, and that combination has dramatically changed the spectrum of what it is that we face on a day-to-day basis as we go about our lives and our jobs. But as I mentioned, this problem in the military has created a significant moment in time where focus on traumatic brain injury and resources devoted to traumatic brain injury have risen commensurate with the rise in incidents in military health. But we also know that this is a major issue in sports and recreation across the U.S. And this perpetual balance of the value of sports and the value of exercise against the real or perceived risk of concussion in the world of sport. But 2.8 million people are diagnosed and seek care in the United States with a traumatic brain injury. And the precise number is actually very difficult to pinpoint, and various people have come up with a different answer. But this silver tsunami of the rapid growth of size of the older American population, combined with the active lifestyles of this population, superimposed on the medication profiles of this population, has created a whole nother swath of traumatic brain injury patients for us to contend with, and yet another focus for the concept of prevention being worth an ounce of prevention being worth a pound of cure, that this population at the bookends, the pediatric population and the older adult population in particular, are keen areas of focus for injury prevention. What's pretty remarkable is that in spite of all this attention that has been paid to concussion and traumatic brain injury, in spite of the fact that we know that there is a real problem in our warfare, military conflicts, there really still is a vast underappreciation for the scope and size of this problem. That 4.8 million people present to an emergency room in the United States for an evaluation of a traumatic brain injury. 2.8 million of them leave with a diagnosis of traumatic brain injury. We know that the CAT scan is really not a terribly helpful thing for the vast majority of them. The CAT scan is not going anywhere. It's a fantastic tool to identify the patient who requires emergent neurosurgical intervention. It's not a terribly efficient tool to help us understand people who are hurt and are going to go on and suffer a consequence from a traumatic brain injury but aren't in need of surgery. And that patient population in particular has proved to be vexing. And I say that because as our colleagues at the University of Michigan and as other consortia like TRACK TBI have looked carefully at this problem, we find that this cohort of patients who are brought to an emergency room, have a negative head-CT, and are told, you're fine, go home, they really aren't okay. And a very large percent of them continue to be symptomatic and continue to exhibit sequelae of their traumatic brain injury months later. But when you ask clinicians about this, and Fred Corley at the University of Michigan did this fantastic study where he cataloged this and found that the clinicians think that only 4% of these people are going to have a problem 3 months later, when in fact 47% of this cohort ended up with issues persisting at 3 months. So there's a huge disconnect between the impact of traumatic brain injury and the clinician appreciation for the risk of that impact. And we looked at this more carefully in the Traumatic Brain Injury Consortium TRACK TBI, which is across 18 centers in the United States of America. And when we tracked people systematically who were brought to an emergency room and given a diagnosis of, quote, mild traumatic brain injury, end quote, we found that even a year later, 60% of these folks had failed to return to work full-time without symptoms. That's a big problem. And we have very little resources that are targeted at this. And in fact, when we looked deeper, we found that even for people who were hospitalized in an ICU, on average, around 44% of them were even given a follow-up appointment. It's a pretty remarkable disconnect between the size of the problem, the scope of the problem, and the resources assigned to it. But in the end, we know that this problem reaches every aspect of the globe. Road traffic injuries are now the leading cause of death for children and young adults aged 5 to 29, and the most common reason to die of a road traffic death is a traumatic brain injury. This is a huge opportunity and a huge critical need for neurosurgery to remain front and center in the global fight against this significant problem. But it really begins with the premise that if we can achieve that ounce of prevention, it will in fact be worth a pound of cure. And the neurosurgeon matters just as much in the need for an emergent craniotomy for evacuation of an epidural hematoma as the neurosurgeon matters to the patient who is otherwise told, you're fine, go home from an emergency room, when in fact that person has a 60% risk of ongoing problems 3 months later.